Hey, Mr. Smith is 2 hour post-op, and he's having some trouble voiding. He did it a little bit like an hour ago. You want to know what you want me to do about it, or?
Just go ahead and put a forward in. It's fine.
Are you sure it's only
Yeah,
2 hours?
Yeah, it's fine.
Okay, all right. Hi, Mr. Smith. So I talked to your doctor, and she wants to go ahead and put a catheter in, okay? Just to help you use the bathroom after surgery, all right? Okay, so we're gonna go ahead and do that for you. Okay, didn't think this through. All right, Mr. Smith, go ahead and just take a big deep breath for me, okay? And here we go. Wasn't too bad, was it? I hope not. I'm just gonna hook this to your bed for you. All right. Doing okay? And I'll be back in a little bit to check on you, okay? Hey, I was reviewing your orders for Mr. Smith, and he's had his catheter in for 4 days. Did you want me to go ahead and discontinue it? Because you need to put the order in for me, or?
How's his urine output been?
He's doing well, yeah.
Oh, well, I mean, it seems like it's been effective, so, I mean, you can leave it in if you want. We can probably leave it in for a few more days.
Perfect. Oh, okay. All right.
That'll be fine.
Okay. Thank you. Mr. Smith, I just came to look at your output real quick. Well, you're looking good, it's just on the floor. So I'm gonna go ahead and move it over here for you. All right, do you need anything? Okay. All right, have a good day.
Hey, good morning, Mr. Smith. It's time for your catheter care. Let me just see if you're dirty. No, you look pretty clean, so we're not going to worry about it today, okay?
Okay, hey guys, thanks so much for coming. So I'm Arden, I'm the Director of Infectious Control here at the hospital, and we were looking at data, and we've had a 2% increase in catheter-acquired urinary tract infections. And so we went over some data, and we've implemented some new protocols, and we're going to go over that today so that we can lower our incidence of CAUTIs here in our department.
So we're going to start off a review of what a CAUTI is. So a CAUTI is a catheter-associated urinary tract infection. It's a urinary tract infection that is directly caused by the improper use of a catheter. CAUTIs are considered to be the most common nosocomial infection worldwide, contributing to 30% of all reported hospital-acquired infections. A concerning statistic considering hospital-acquired infections are one of the leading causes of mortality and morbidity across the world, and a direct reflection of the quality of care that a hospital provides to its patients. Catheters provide a direct portal of entry into the urinary tract. Unnecessary catheterization and prolonged use of a catheter are the most contributing misuse factors to the development of CAUTIs, as well as break and sterile technique with insertion, improper catheter care and improper drainage bag placement, and maintaining a closed system. But the common denominator between all these contributing factors is that they are all 100% preventable. So why should we care? UTIs associated with catheter insertion have proven to be increasingly problematic, not only for the patient, but healthcare facility and healthcare professionals as well. CAUTIs ultimately result in the introduction of serious healthcare complications, including increased fever, uncomfortable manifestations and symptoms, and something as serious as sepsis if left untreated. A sicker patient leads to extended hospital stays, which leads to increased hospital expenses, resulting in negative patient attitudes and compromised health, and ultimately the reputation of the hospital. A domino effect continuum of problems caused by preventable factors. Within recent years, many insurance companies have decided that they will no longer cover the cost of hospital stays due to cases of CAUTIs that occurred within a patient's hospital stay. The average cost to care for an individual with a CAUTI for just one day is estimated to be anywhere from $1,000 to $3,000 per case. So how are we going to address these problems using evidence-based system practices? The best way to prevent CAUTIs is by avoiding unnecessary catheterization, which makes sense. Lowering the number of unnecessary catheter insertion directly correlates with lower incidence of infections contributed to catheters. To see that unnecessary catheterization doesn't occur, collaboration between the physicians and nursing staff is imperative. It is important to remember that as a healthcare team, we are patient advocates. A catheter does not need to be placed for the convenience of the staff, such as collecting frequent urine specimens and for incontinent patients. If there is a patient that no longer needs the catheter, the physician should be contacted and the catheter removed. In 2007, statewide Michigan hospitals launched a CAUTI prevention initiative called the Keystone Bladder Bundle Initiative to reduce the incidences of CAUTIs. They found that the more frequent use of preventive practices such as the use of bladder scanners, stop order reminders, nurse-initiated discontinuation, and removing a catheter within 24 hours of a postoperative patient, they were able to reduce CAUTI rates in the state of Michigan by 25%. By addressing preventable factors such as urine backflow into the bladder from improper catheter placement, letting the catheter come in contact with the floor, neglected perennial care, and trauma from an overfilled bag, we can lower the incidence of CAUTIs in our department. Michigan's Keystone Bladder Bundle Initiative is proof that the factors that contribute to CAUTIs are preventable and, if addressed, can change outcomes for both healthcare systems and the patients. Some healthcare system outcomes include decrease in extended hospital stays, decrease in costs, decrease in contribution to statewide and nationwide CAUTI statistics, and improvement in hospital reputation. For patients, the outcomes include a decrease in extended hospital stay, which can be as long as an extra 2 to 4 days with the development of a CAUTI, increase in patient satisfaction, and improvement of the patient's overall health. So after researching successful CAUTI prevention interventions, our department is also going to be implementing and emphasizing some new interventions, such as in-service CAUTI education required for hospital staff every 3 months, the implementation of specialized CAUTI teams within the department, diligent hand washing and sterility, nurse-initiated discontinuation of catheters, holding one another accountable, and meticulous charting.
Okay guys, so now that we've gone over the new protocols, I just want to know what you guys think. Is this something that you feel like we can implement here in the department?
Yeah.
Awesome. So we're going to be doing meticulous documentation and keeping track of the trends and see if we can lower our incidence here of CAUTIs in the department.
Sounds good.